Hi folks, for those that don't know me, my name is Dr. Mike Lloyd. I'm the director of the CTAD Clinic. The CTAD Clinic stands for Complex Trauma and Dissociation, and this is a clinic that's dedicated as a referral centre in the UK to people suffering with dissociative disorders, often from childhood trauma. But the purpose of the video today was to sort of share some different news really. It's Saturday morning and I've just let all the ducks out, and you can kind of see that they're all around and they just had their breakfast and they're out for the day. And so Saturday morning, and on Thursday afternoon I found out that I've been diagnosed with prostate cancer. So I'm obviously a little bit scared about this, even though I've been assured that there's some really good treatments available, and that I should be okay, and that everything should be okay, and within the next sort of 6 to 12 months everything should be all right and I'll be fine and no real problem. But this has really snuck up on me, because for the last couple of years, since I moved into this new place, sort of went to the GP practice and said, I'm over 50 now, and it's probably useful for me to have a general health MOT, just to get a feel for if I'm okay or not, because you hear stuff on the news and you sort of read things about prostate cancer, and it's something that affects men, often of a certain age. My dad had prostate cancer in his 70s and he got treated and he was okay. He's not with us anymore, but for different reasons. So I thought, well, I'll get checked out, and it seemed to be okay, but I had this thing called a PSA test, and I'm going to do some more videos, and I'm going to sort of come on to sort of talk about a little bit more about what that is. The ducks are being a bit chaotic at the moment, so I think they're probably looking for a second breakfast. They're like hobbits or something. So I had some regular MOT, and part of that was this PSA test, and the PSA test showed that it was a bit high, probably a little bit higher than average for someone of my age. So I had some physical examinations, which not altogether pleasant, but it's something that is really important. And from that, it was determined that I would just have another PSA test after sort of 6 months' time, and that again was raised, and there was no particular reason for it. I've got absolutely no signs or symptoms of no symptoms of anything to do with prostate problems. Sort of no irregular, going to the toilet and weeing, and no blood, or absolutely nothing whatsoever that would suggest anything was wrong. So I got put towards an MRI scan. So I had that scan and everything seemed okay, but my PSA test was still high. So I had a biopsy 2 years ago, and that involves an internal biopsy, taking 20 different samples from my prostate and having a look at them and seeing whether or not everything was okay. And at that time it was completely fine. So I had 20 samples, and it pretty much said that all 20 of those were okay. So we're just going to keep monitoring, and then for the next year or so I continue to have 6 monthly blood tests with the urology clinic at the local hospital, which is in Chester. It's the Countess of Chester, brilliant hospital for many things. And then my PSA test never came down, and again, no symptoms at all, completely fine. It's just one of those things that I was sort of almost getting used to. Had another MRI scan, and that showed that was fine. And then it was suggested over the summer that possibly I was going to need to have another biopsy, which I really didn't want to do, because it's kind of unpleasant, it's painful, it takes a while to get over from, and it just disrupts things and kind of makes me feel really sick. I put myself through that, and then about 3 or 4 weeks ago I had my second biopsy, and my wife and I went into the clinic on Thursday afternoon, just literally like less than 2 days ago, sat down with a consultant and a nurse, and they said that there were 7 points of cancer on my prostate. Which basically means I've got to do something about it, or the potential is that it can metastasize, and it can turn into something much worse. It can affect the surrounding areas. The cancer can grow, and that's obviously extremely dangerous. So they're recommending kind of immediate intervention within the next 2 to 3 months, or possibly 4 months at the outside, depending on the waiting list and things. I'm going to have an appointment in January with a consultant surgeon and from the urology team to talk through different options that will be available to me, just to sort of see what it is that I can actually possibly achieve and get the best results from. So I wanted to do this video really for sort of the men out there. Chris Hoy has just been diagnosed with terminal prostate cancer. He's only 48 years old. He's like 5 years younger than I am. Obviously didn't have anything checked. Most people don't start checking this stuff until they're over 50, which is kind of the recommendation. And obviously he's in very, very late stage cancer of the prostate. I'm in a very early stage. There are 5 different stages and I'm in stage 2. So it is good, but basically 2 years ago I had absolutely nothing in my prostate. That was confirmed from biopsy, and now within 2 years I've got 7 points, so that means that my prostate is cancerous, and it's happened very, very quickly. Didn't expect it, never thought this sort of thing might happen, or if I did, I thought it might at least happen when I'm a lot older. So it is so important to think about this. It's a difficult examination for a lot of men to go through. It's kind of a bit undignified. It can be a little bit embarrassing. The clinical teams, they don't care. They just get on with it. They are so brilliant. This is what they do every day. Nobody makes you feel embarrassed. It's a brilliant group of people that are assessing this and just making sure that everything is okay. They want the best for everybody, but men need to get this stuff checked out. If I'd have just gone, well, you know what, I have no symptoms, there's absolutely nothing wrong with my waterworks, I've got no blood, got no pain, absolutely nothing, I'm not bothered, there's nothing going on, I could have gone 5-6 years down the line and I could be in the same situation, having terminal prostate cancer, and that could be the end of my life. So purely because I wanted to get that done, I was over 50, I wanted the test was pretty weird, and that's the sign. So the sign of prostate problems is the measurements and the tests and the test results. The symptoms, I have no symptoms, but I have signs, and that PSA test, even though some people are saying it can just be normal that it's raised, some people are just like that, for me clearly that wasn't the case. So the sign was there, and even though nothing showed up on the prostate, my PSA level was still high in my blood test, and that meant that there was something going on, even though everything else was invisible, and I felt no problem whatsoever. So I continued with that under recommendation from the health team at the hospital, and now 2 years down the line I've got something which I'm told is eminently treatable. It's going to be difficult over the next sort of 6 to 12 months. I'm going to face a lot of challenges that I've never had to face. And I think I'm going to keep doing some of these videos and just talking about it a little bit. It's very different from my usual. Obviously, if you watch some of the other videos, I'm really happy and confident and getting on with things, talking about my work, talking about issues related to trauma and dissociation. And this is very different. So I'm not at my desk, I'm not doing my usual thing. I'm out in my garden, I'm out with the ducks. This is kind of my peaceful place. The ducks are really helpful for the clinic. Lots of patients really sort of appreciate and spend time with them. And it's a really nice place to be. So I thought this is where I'm probably going to do some videos from. And just do some updates on what's going on, and kind of keep delivering the message as much as possible to men to say, please do get this checked out no matter what. Don't worry about the symptoms. Once you get over a certain age, go get this checked out from your doctor. It's absolutely worth it, because something can be done, and I'm really hoping that everything's going to work out. And I'm going to go through a story about this, because I think that's a nice thing to do, and people do appreciate those things. It's going to be a bit more personal than normal. It's going to be a little more emotional than normal, so I hope that's okay. I am okay, I'm just kind of scared. I haven't had time really to get over this or to think about it. Literally 2 days. I'm still kind of getting my head around exactly what it might mean, and the consequences and impact on my life and my work and whatever that might be. I don't know yet. I am kind of sort of, with me, I'm making this up as I go along with my friends and my family and my ducks and my cats. And sharing is just something I felt was an important thing for me to do. So I hope this has been okay. And if there's just one person out there, it's a cliched message, isn't it? But there's just one person out there that watches this video, goes to the doctor, has a test, finds a high PSA, gets it investigated, and that does help them, like it doesn't get worse and they can get help treated, then all of this will be worth it. 10-11 minutes of my life to potentially do some good for somebody else is an easy thing to do. So yeah, thank you for keeping this far. Thank you for watching this video. And yeah, I'll keep doing my normal stuff. So if you're interested in the work that I do elsewhere, it's all on the channel. That's going to carry on. I'm not going to change that. I'm just going to do these things slightly extra. So thank you very much for sticking it out this far, listening to me warble on. And yeah, as always, do take care of yourselves. Thanks.